that with you. Super excited. And her name is Olive Rose. So I was asked to share that photo this morning. So just wanted to share that with you. Hopefully you saw yesterday we have some special announcements on the call today. So we're going to get onto that in a few seconds here. So thank you so much for joining us this morning. And we've got our normal welcome here. And then before my updates, I have a couple of guests on the call, very special guests. We have Alex Rubio and Elsa Haro Rapp from Scan Health Plan to announce something pretty exciting to everybody today. So I'm really excited to get that announcement out there. And then we got our usual AMA updates. We're going to go through a couple of the CMS policy and technical changes for calendar year 2025. You might have seen some of this already on LinkedIn, some of the stuff that affects you. Wanted to get that out there, that information out there to you. Then Julie's going to go through any questions that you guys might have and just kind of cover some of the stuff she's seen this week as well. And then I'll carry out our updates. So let's get started, I think. So we have a pretty exciting announcement today. Hopefully you saw that email that came out yesterday, hopefully getting you guys on here and excited about a pretty exclusive opportunity for everybody with Scan Health Plan. So Elsa and Alex, are you guys on? Are you able to unmute yourselves?
Oh, yeah. And my gosh, Neil, your voice, you should be doing like love songs on the coast.
Oh,
love it.
You've reached AMA Radio.
I'm telling you.
Oh, my voice is, this is tired Neil's voice.
I love it. I freaking love it.
Awesome. So I've got your little slide up here. First of all, for California here, Elsa, wanted to give you the opportunity just to talk to the folks on the call and tell them a little bit about this exclusive opportunity.
Just start by saying this is like the sunniest part of my week. I just love everyone here. You can't see me, but I'm blowing kisses. But yes, I'm excited. This is not being rolled out to everyone, except for AMA, of course. We love you guys. And because of your fearless leader, Neil said, can we just do it for everyone in AMA? And we're like, that's an ask above me. But of course, they're like, yes, of course. So kudos to Neil and asking, what needed to be asked. And in California, it's a little different. This is called a broker marketing reimbursement program, and I'll let Alex explain his little portion. So it's $1,000 for the first 10 enrollments for a 1/1 effective, okay? And then after you hit the first 10, it's $100 for every subsequent one. But there is parameters around it, and that is starting, and you don't have the dates on here, Neil, but it is starting 11/1 to 12/31. Do you have them on here? I'm just not seeing them. So those are the ones that count. So everyone always says like, well, great. I started writing 10 last year. Does that count? There's a parameter, 11/1 to 12/31. So yes. And this is just to get everyone, a little excited. You're at 7, let's get you to 10. Let's put a little juice in there and get you going and get you excited. And of course, do you have the flyer I sent you, Neil, so we could talk about like what are things you can, and it's going to be in California for all plans except venture, and you have to be in good standing. So if you let your license go and you're not contracted, or then you just zoomed right past. There we go. Ooh. And, I'm just giving you the little highlights, but we can, the lawyers in the group, I know we have a few, you can read it in great detail. Then we can, some of you may have already read it and say, I have questions and we'll talk about it. But these are some of the CMS approved reimbursement examples. Mileage, sign me up all day. We all drive everywhere. So yeah, you could probably sign off on $1,000 mileage easily. And other things that count is postage, printing, trade shows, meals, digital marketing, advertisement purchases, meeting room fees. Sometimes they charge a fee like at a Coco's or Marie Callender's. That's showing my age, right? When I sold. A storefront display, et cetera, et cetera, et cetera. So we're excited. And Alex, throw in your color, because that's all I have. It's pretty straightforward.
Well, not much to add to that, Elsa. Thank you for the great job. So when it comes to Nevada agents, everything is pretty much the same minus the amount. So we actually have lowered it to 4 apps and $400. So it's still the same, basically $100 per app, except we've lowered that initial payout to 4 apps. So everything else stays the same, as Elsa had mentioned prior, the same reimbursement types, the same time frame. Oh, we have the time frame there, 11/1 through 12/31. Apps must be submitted for 1/1 effective dates during that time frame. So like I said, nothing to add to Elsa outside of we just lowered it to 4 apps instead of 10 apps. And so those of you that are there in California, if you happen to dabble in Nevada, that 1 app for Nevada would count towards those 10. So, we're not going to look at your California apps versus your Nevada apps. If you want to combine them, I think as long as you guys get to 10, you're going to be good to go. So, yeah, not much to add to that. Really excited about this opportunity. And yeah, kudos to Neil. Like you said, Elsa, he made that call to you and me, and we were both like, that's above us.
Yeah.
And obviously we did it. So kudos to Neil for getting all of AMA on this program. So really excited about this. I hope you guys are excited. I see a lot of thumbs up, so that gets me excited. And again, if you have any questions regarding Nevada, I am your go-to guy. And yeah, that's about all I got for you guys.
One little tiny exclusion. There are some folks that we've paid co-op to up front, and those names are going to be excluded. And the way they kind of look at it is we don't give co-op to everyone, right? Like I see like names coming up, and I know we didn't give co-op to that person, absolutely. And you're kind of those that get qualified for co-op, we're kind of giving you the money up front. We're holding you to a number to get to, right? But this is like pay for play. You're going, so those that are excluded, you kind of got your money up front, and it's really meant for the agents. This program is really, this is not a Neil program. This is Neil's downline agents to get some money and offset the cost and offset gas that we cry every time we put gas in. So just know that if you're on this call and you're like, whoo, that's me too. But if you got co-op front, there's some exclusions, and we can talk about that afterwards, but go get your money. I'm going to go sell an expansion, Alex. Sheesh, sign me up for expansion.
Bring it on.
Yeah.
So for example, if somebody has sold already 4 after November 1st, they're already making this money, right?
They'll have to get to 10. Oh, for Alex,
well, and yeah, Nevada, yeah, someone that has already sold 4 1/1 app effective apps after 11/1, yes, they pretty much are done.
And then every app after that is 100 books, 100 books, 100 books. So yeah, that's awesome.
So somebody sold 20 between November 1st and the end of December here, they would make $2,000.
Glad you did the math, because I was like, Alex, do you have a calculator?
Yes, you are correct.
Pretty amazing. And like I think Alex said, if you live in California and pretty much do the California market, and you do 9 and then you do 3 in Nevada, that will make your 12. That will make you eligible for the 1,200, right?
Is that correct, Alex? Or are they separate?
I believe so. I opened my mouth, so we're going to make it happen.
Awesome.
I'll be like, I don't know who's Alex, but yeah, you know what?
Hey, that's the former employee, Alex.
Elsa, that's okay. I'll go with you, Alex. That's fine.
This is pretty awesome, and thank you so much for making this happen and helping our agents. As you say, this is great. Whereas if you've done 5 or 6 or 7 in California, this might help you guys get to 10. And I think this is what this is for. And again, in Nevada, if you've done 2, it might help you get to 4. And, you know, the fact it's being
Yeah.
reimbursed is amazing.
Yeah. And when you're putting gas in your car like me every other day, you know, $90 and above, even if you think, well, I don't have receipts, if you just sign an affidavit for the mileage. So yeah, sheesh.
So no receipts either, which is pretty cool, right? So you just got to write down what you've spent or how you're going to get this reimbursement, but you don't need receipts. Is that right?
Alex, that's an Alex question.
As
He's
you know,
gone.
I'm pausing on that one.
I'm pretty sure there's no receipts. I looked at the form
Uh,
actually here and yesterday, and it said
Yeah, I
no
don't remember.
receipts. You
I
just got to
don't
sign that
remember.
affidavit, as you said there, Elsa.
Scott, if Scott's read it, Scott will tell us. Scott's our lawyer.
There we
He'll be
go.
like, well, I love his attention to detail. Alex and I are like, we're just, who's seeing the laughing face, the crying face? But yeah, we're just, you know, Alex and I, we're like your typical salespeople. We're like, what do we need to know? $100? Okay. $100.
$100, that's it. But great questions, Neil. We're definitely going to verify that
We'll come
just
back.
to make sure we're not all caught off guard.
Yeah,
Yeah.
absolutely. And
Yeah.
one thing I did notice is you're only allowed to put 1 reimbursement claim in.
Oh, that's the
Yes,
best detail.
yes. Thank you for bringing that up. We don't want you all to write, you know, let's just say Nevada, you write 4 apps and you submit a invoice for the 400, and then at the end, towards the end of AEP, you write another 4, you send a second form. So just wait until this time frame is over, all your apps, and then take into consideration how many apps you've written during this time frame for 1/1. If it's 10 apps, then just submit 1 invoice for that $1,000. We don't want to add too much burden on our team and have multiple invoice coming in, and then we have to verify, did they write these 4, and then the next 4, and then the next 4. So if you could just kind of wait, do 1 submission before the deadline of 1/19, I see it right there. Yeah, we would greatly appreciate that.
Plus, if we make it easy, you know, you guys will ask, what about after the 31st? Alex and I will be asking the same question. So let's make it easy and streamline. And then, you know, what's going to happen. You think you're done selling? We take FEMA. So you're going to keep selling. In California, we have FEMA for everything. Hillary, thank you, Hurricane Hillary. Yeah, so we are going to take apps after the 7th. So even if you think, oh, I'm done, and then you get a call, wait till the 31st, because you may be submitting those last stragglers, and you can with SCAN because we take FEMA.
Yeah, great point there, actually. Great point. Thank you so much.
Yeah.
Wonderful. Well, thank you guys for coming on our call this morning. This was really exciting, and wanted to make sure all of our team had the opportunity here. And as we said, this is exclusive, so don't tell other agencies, because this is a invitation only opportunity apart from with AMA. So
Thank you, Richard, you little sweetie pie. Yeah, so thanks everyone, love you all. And like I said, you guys are like top visibility, so rock it, make Alex and I look great, so we could just be like, ta-da, look what they did.
Absolutely.
And real quick, we have a few
got to actually
here.
hit some numbers.
Yeah.
We have a few questions here. Someone asked, how about for December 1st effective dates? Unfortunately, this is only for 1/1 apps. So yeah, so no 12/1s, unfortunately. Someone asked, can they still recertify for 2024? Absolutely. Go ahead and certify, get ready to sell. Hopefully you can get the last couple weeks of AEP in your portfolio here. And then lastly, can we certify for, okay, 2024, I already answered that. So perfect. I think we got all the questions answered. And that's pretty much it. Thank you all.
Wonderful.
All right, go get your money.
Thank you for joining us. Thank you for jumping on. This was all done last minute between like 4 o'clock and 8 o'clock last night, everybody. So
all right.
Thank you, Alex. Thank you, Elsa.
You got it.
We
Take care
appreciate
now.
you
Bye.
both.
Bye, everyone.
Bye-bye.
Awesome. Okay, so let's move on. Yes, I know the Nevada slide said California, but basically it's 4 in Nevada, 10 in California. If you live in Texas, it's 4 as well, by the way, because that's an expansion state. So, but I was putting this slide together at pretty much 7:52 this morning before we came on. So please bear with me. Okay, so a few updates. We got 4 weeks left, I think. 4 weeks exactly is left for AEP. We are still not halfway. We are almost at halfway. I believe the expectation is the last 2 weeks is gonna be crazy. It's gonna be busy. Everybody at the moment seems to be taking their time, making their decisions. I've seen a lot of folks saying, I'll think about it, and yes, we'll get back to you. So please expect your last 2 weeks to be busy. So from really from Thanksgiving, so from Black Friday onwards, they're the last 2 weeks. I believe they're going to be pretty crazy. So you might want to leave yourself a bit of time to write business for sure. So activity wise, keep going with that activity, keep going with your leads, do whatever you can over the next few weeks, but leave yourself some time to write apps, please, for sure. We know about the cost for Medicare, PDPs. There are some great PPO plans available. You know, we got United, we got Alignment, we got Aetna. All of those have got great PPO plans. Humana, don't forget, they have got new PPO plans in California this year. So a lot of our carrier partners are seeing an increase in those enrollments in those plans. So lots of reasons for us to be excited going forward. 48-hour scope of appointment. I'm still getting questions every single day, folks. So if you are booking a set appointment, yes, you've got to wait 48 hours. But if you work in a kiosk or you're doing an informal sales event, somebody walks in or you get a phone call. We call it a virtual walk-in. You do not need the 48-hour. So somebody calls that phone of yours and you pick it up. Hi, this is Neil. How can I help you? Blah, blah, blah. Yes, I'd like to talk to you about a plan. Okay, great. Can you sign the scope of appointment? That's a virtual walk-in. You do not need to wait 48 hours. And don't forget as well, the last 4 days of AEP also is a time where you are not going to need that 48-hour rule. So there's a few, a few anomalies here. So the last 4 days and of AEP or any enrollment period, in fact, and then if you get that virtual or physical walk-in, you are not going to need to wait 48 hours. Okay, so a lot of you doing events at the moment, particularly those of you that are doing events at some restaurants for Optum, Archwell Health, Centerwell, these type of places. Please, I know Eve sent you an email yesterday or the day before asking you to send that feedback to them. Please send that back to them. That is, or fill that in. That's important. I've got to go back to these guys and request, or send them information. They're requesting that information from me. So please try and give us that information. Also, we got some exciting opportunities coming up this weekend or next week. So WellCare is doing a live in-person call blitz for our Las Vegas agents at their office, and I can send you the email. So the first 10 agents that email Lisa today, thanks Lisa for collecting this information, you can have the opportunity to attend. So that is next Wednesday, I believe. I'm pretty sure it's next Wednesday. It is Wednesday at between 11 a.m. and 1 p.m. So if you want an opportunity to call some leads, if you want some leads, please reach out. We'll send you that information. I'm going to be there as well next week. So would love to see you there. We've got the opportunity for 10 of you guys to attend this event. So please, if you want to attend, let Lisa know and we'll get you on that list. These are leads that are coming in from WellCare. It's exclusive to us. It's our own event. It should be fun. And it's an opportunity to write some business. So pretty exciting. Also, United Healthcare are doing another call blitz this weekend. this Saturday at 10 a.m., so 11/11, they are doing 2 call blitzes, one for LA County and one for the Pacific Central Coast. That's what PCC stands for. So if you've never worked in that area, and you don't have to live there, if you sell in either of those areas and you want some leads, please let us know. Ideal scenario here is you would email Rosa Colindres or Rachel Umarino. Rosa is the sales director for those areas. Rachel is the broker manager or the agent manager here. So please email them. If you don't have their emails and you want to participate, so say, for example, you live in, I don't know, Fresno, but you sell in LA and you're like, you know what, I want some leads on Saturday. If you don't know those agent managers' numbers, email me or Lisa and we'll get you those numbers today, her email, and get you situated. Again, as many of you as possible, if you want to participate, this is a really nice opportunity. Last thing, don't forget our AMA portal has now got the enrollment reporting tool. So that is up and running. So if you're doing an AMA sponsored event, then please use this tool to report your enrollments or sales. Really, this is important for me to understand our return on investment. It helps me then understand what type of events we can then participate in next year. So this really helps me understand what's working, what isn't working, and what events we can participate in, and ultimately help you guys co-op or help you with these events financially as well. So please, if you can send that information through our portal, that'd be great. Okay, you might have seen this. CMS have put out a lot of information. I'm not going to go through this line by line. There's a lot of information coming up, but please take out your phones if you want to take a photo and read it later. One thing I am going to do, though, is talk about this first page. So this first page is all about some of the stuff that we are involved with, like compensation. Yes, agent compensation. So this week, you probably saw that CMS issued some information on a proposed rule. And this was built on the existing Biden-Harris policy to strengthen our beneficiaries' protections and also to help those guardrails as well. The proposed policies would promote access not only to behavioral health, but also promote equity in coverage and improve supplemental benefits. Going to talk about those items later. The one that affects us really is promoting equity. And what they're saying is, look, some of the carriers are offering additional compensation on top of what agents are getting. And they are saying, look, we don't want folks to sell based on that. So they are proposing to redefine compensation to set a clear fixed amount that agents and brokers can be paid regardless of the plan. So what they're saying is, like our friends at Scanner just offering a marketing reimbursement, CMS essentially is going to try and stop that type of thing. That's what they're trying to do, essentially. And in fact, it was perfect today that came, and then obviously we saw this come out. Not perfect for us, because as agents, they're going to try and stop that. So essentially what they're trying to do is they're trying to cap the amount of money that agents can earn to 642. That's the national number. So because obviously you folks that live in California get more for enrolling in California, then this is just the national rate here as well. So essentially the CMS is trying to cap what agents are getting paid. Not great news. I don't love it either. I get it, but I just want to share this information. The proposed rule generally prohibits any contract terms between Medicare Advantage plans, organizations, and marketing middlemen, such as FMOs, that's us, that result in things like volume-based bonuses for enrollment in certain plans. So we just heard a marketing reimbursement is going to stop that. So this is another reason why we want to take advantage of it when it's here, because CMS want to actually limit that and stop that for 2025. Thank you so much, Biden Harris. Not again, is a challenge here. Obviously, we've got an election next year, big election, which could change all of this. And again, this is for the proposed 2025 year plans. So this is those proposed rules that are going that essentially CMS want to bring in. So wanted to share that with you. Also, some other stuff, and this is the frustrating thing, that some of the stuff that CMS wants to do, I think, is amazing. Again, they're trying to take steps to improve access to behavioral health. We know that mental health, behavioral health, that type of thing is on the rise since COVID, and CMS is trying to take some steps to improve the access to those services as well. And again, you can probably read this. I'm not going to go through this whole slide. So if you want to read this in detail, CMS, this is taken exactly off the CMS website. Take a photo if you want to read this later on. But again, as you can see, there's a ton of people that this is affecting, particularly things like addiction, drug and alcohol, that type of thing as well. So this is going to also affect those folks that need to see those counselors as well. So this is actually a good thing that's going to happen. But again, this is a proposed rule. Let's move on. This is the mid-year enrollee notification. Again, I think this is pretty good because what happens is, as you know, a lot of the folks get, oh yeah, you can get $2,000 a dental, you can get OTC of $200 a quarter, whatever it might be. You get all of these great benefits, right? Or our clients do. Well, funny enough, a lot of these supplemental benefits, folks are not using. So CMS is proposing halfway through the year, so like June or something like that, the unused supplemental benefits is going to be issued. So that way we can reach out to those folks and say, look, a lot of people have not taken advantage of their podiatry, just taking that out. So this is an opportunity for us to really remind our clients what those benefits are, and those benefits are there to be used, but a lot of folks don't use them. So this notification would include the scope of benefit, the cost sharing, blah, 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 blah. This is another thing, another good thing that CMS is doing is it's encouraging our clients, our enrollees to use and enroll and make sure they utilize those benefits that are available to them. That's pretty exciting. So I do like that as well. Again, take your photos out if you want that information. Okay, and then there's some new standards that they're proposing. These are proposed for the chronically ill. You probably heard of the phrase SSBCI, and that again is the supplemental benefits for those folks that are chronically ill. And again, that's what it stands for, Special Supplemental Benefits for the Chronically Ill, SSBCI, which are benefits that are provided to those folks that qualify. And it's there to help them improve and maintain their health or overall function. Well, CMS is proposing these new requirements that Medicare Advantage plans demonstrate when they submit their bids, and the services that they offer meet the thresholds of having a reasonable expectation to improve their health. So essentially any benefit they're going to put forward, it's supposed to increase their overall health or overall function. That's essentially what it is. And again, CMS is proposing that plans establish and maintain bibliographies of relevant research studies, blah, 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 blah. But essentially what it is they want to make sure that these benefits actually help the overall kind of health and function of those folks that do need these benefits. So again, I think this is a good thing. Take a photo if you want. And then the last thing I think I've got on here is the annual health equity analysis. I'm not really going to go through this now, but essentially it's, this is to make sure that health equity, and what we mean by equity is healthcare across all of our seniors. So this doesn't matter where you live. It doesn't matter how much money you have. it's equity between the poorest of the poor and the richest of the rich. That's what equity is, to make sure everybody gets access to care as well. So take a photo of this. It's supposed to be, make sure we're transparent, or the carriers are transparent around identifying disproportionate impacts as well of some of these policies and procedures as well. Okay, and it also includes Part D, LIS, or extra help as well. So that's another thing that CMS is trying to get through. And it wasn't the last one. The last one is the Quality Improvement Organization, QIU. And again, this is a review of a fast track appeal for traditional Medicare beneficiaries. Again, don't want to go through this in detail, but it does basically enhance enrollees' rights to appeal a Medicare Advantage plan's decision, basically to terminate their coverage for non-hospital services. That's essentially what this is. So take a photo if you want to read more. Oh, one more. I was wrong. And again, the last one here is to increase the percentage of dual eligibles, managed care enrollees who receive integrated services. So again, this is all about receiving those integrated services, managed care services for those on Medicare and Medicaid, or part of the LIS or extra help program as well. Again, take your photos out. And limiting out-of-pocket costs for D-SNP PPOs. So obviously, if somebody goes to a PPO on a PPO plan and goes out of network, this is going to limit the cost for those folks that are dually eligible as well, or on Medicaid. That's essentially that as well. Oh, we got more. And again, the last one here is the plan risk adjustment, data validation, appeals process. This is just a change, or making sure the appeals process is easy for our consumers. So this is what this screen is as well. So please take a photo if you're interested in that. And again, this talks about those D-SNP lookalike plans that we know went away, but there's those D-SNP, C-SNP plans, et cetera, et cetera. So they are proposing to lower the lookalike threshold from 80 to 70%. So where some of the lookalikes were allowed to stay because, you know, less than 80% of those folks were enrolled were D-SNPs, now they're lowering it to 70%. So essentially, they're trying to get rid of lookalikes. That's essentially what they're trying to do. And then this really is just talking about flexibility for biological products. So again, if you want to take a photo of this, please do. And this has all come from our current administration. Now we're at the end. So I'm going to give my voice a rest and hand you over to Judy.
Thank you, Neil. Good morning, AMA agents. I'll be quick here because I know that we want to make sure that you still have some time back in your day. And that was great news from SCAN Health Plan. So I wanted to just mention, first of all, I was out in the field this week and, you know, heard a lot of things. But I want to start out by saying just one quick comment about the proposed rule that Neil was just doing a great job, by the way, of presenting to you guys, because it's a complicated document. And quite frankly, Neil, you broke it down beautifully. There is a public comment period that will start next week on November 15th. And that is when they will receive public comments and opinions and ideas and so on from you guys, from the general public. And a lot of times that can cause them to maybe say, oh, you know what, it's going to create more of a mess than what we thought. So we're not going to do this particular thing. Or they may actually listen and say, okay, maybe we need to adjust some of the wording on this and so on. So Ann McGlamery, our Director of Compliance at Berwick, was just on the phone with me this morning about this very thing. And she's going to provide some information on how you can easily do a comment starting next week. And then we'll share that with you next Friday morning on the virtual coffee chat so that you can have a voice that can be heard with your opinions. And yes, this is a proposed rule. If everything goes as they want, they make any adjustments or whatever, they usually get finalized in March or April, possibly May of the following year. So, out in the field this week, guess what? I was involved with a lot of needs analyses that were done at some sales meetings. And one thing that kept popping up, this is very, very interesting, that WellCare Part D plan that's available in California for just a 40-cent monthly premium has a very strong formulary. It was amazing. Not only did it come up at the top of the list when we did the needs analysis, the cost of the medications was also very much lower than some of the other plans. So don't discount that as a good plan. Just because it has a 40-cent monthly premium doesn't mean it doesn't have a good, strong formulary. It absolutely does. And this is why we need to do these analyses. Also, as Neil said, people are waiting and procrastinating. So we will indeed be slammed after Thanksgiving, which is November 23rd this year. So we're going to have a full 2 weeks after Thanksgiving this year for these people to finally get off their duff and make these decisions. So be prepared. Please do not take a vacation or some time off during that last 2 weeks of AEP. And also, if you're in a county or you service a county or work in a county that has plan terminations, I'm seeing that a lot of people on these plans that are being terminated as of December 31st are not paying attention to mail that they're getting. So first thing that you ought to do is call your clients that may be on these plans. Excuse me. I personally had about 15 clients in Ventura County that were on the Blue Shield of California, for example, that is terminating at the end of this year. And I had sent out a quick note to each of them. Didn't get a response, so I started calling, and that's when I started to get their interest peaked. And they admitted they're not really paying attention to their mail sometimes. So call your clients that are on these plans at a minimum, call them, and then also offer your services to a doctor's office to do a camp out at their office. Explain to that office manager that plan XYZ is terminating at the end of December in your county, and that you would be happy to help their patients who may be on that plan. Now, you personally can't take possession of a patient list of people that are on that plan. They can make outgoing phone calls. They can also, though, invite you to be able to have a camp out there at their office once or twice a week. So please do that, because it would be an awesome opportunity to help their patients as well as to help yourself at the end of everything. But otherwise, I will just say that, we have a lot of opportunity in Nevada. We have a lot of opportunity in California. Don't get discouraged. It's been a slow start nationally. It has been a slow start, but don't give up. Those things that are working for you, continue to do. Those things that are not working for you, make it like a little bit of a change. Reach out to Neil, reach out to Joel at Berwick's marketing department. Reach out to me, reach out to some of your upline folks, and let them know your frustrations, and maybe we can help collaborate and do something or come up with an idea that will work for you. So keep up the good work out there. And wow, Scan Health Plan is really putting the pedal to the metal there and wanting to get some more enrollments and to help you get reimbursed for your efforts in doing that. That's it for me, Neil. Let's see if we've got some Q&As that we can take care of.
Yeah, we have.
So,
I want to run through some of these here. First question here: can people apply for Medicare Savings Program even though they're not eligible for Medicaid?
absolutely. That is a must, because if they don't qualify for Medicaid, the Medicare Savings Program can help in so many ways, because it has 4 different levels. And so where they may not qualify for Medicaid or Medi-Cal because of their income, there might be a slightly higher income amount, but they can still get some assistance there with their Part B premium and some of those copays.
Wonderful. Thank you. Okay, I want to redo that slide. If first-time client wants to move from Medicare Supplement to MAPD, and then later in the year they don't like it, can they switch back to Med Sup without medical underwriting?
You do have a 1-year trial period if you are moving from a Medicare supplement and you've never had a Medicare Advantage plan before. You're in this Medicare supplement, you enroll into a Medicare Advantage plan, you have a 12-month rolling period where you can go back to a Medicare supplement with guarantee issue. And of course, you also have to get a Part D prescription drug plan, also using the trial period, SEP.
Okay. And again, I think that was for somebody's client that wants to know if a PPO plan works similar to a Med Sup plan. Yes, you can use that PPO plan depending on the carrier. If the carrier has a national network and it's a national PPO, then absolutely, if they're in network in another state, you can use those doctors. So it does work very similar. Some plans are what we call LPPOs, which is a local PPO. For example, I know Alignment has some of those. That's where really you're looking at the local marketplace. But some of the national PPOs are ones, for example, United Healthcare and Aetna would be the two as well. If somebody adds Part B, so say they have just Part A and they add Part B, are they considered new to Medicare? So would this be initial commission?
Yes, it would be. Very good question. You get that higher commission.
Just to let you know on that commission as well, if you read actually how the commissions are stated, it does say that the minimum commission amount is, or the commission amount is the renewal rate. And then it says if somebody is first turning 65 or getting their Part B, then carriers can, and this is what it says in the actual wording, can pay you up to that initial rate as well. So please note that obviously if they're signing up or they're turning 65 partway through the year, it does say they can pay you that full amount. Some carriers do, some carriers prorate it. Okay, that's all our questions so far, Judy. Thank you so much for coming on. We're going to run through those last few slides now before we let folks have some time back on this pre-Veterans Day, and just want to say thank you so much for your service to any veterans that are on the line. So folks like Richard Manning, that I know is a proud veteran, thank you so much for your service. And thank you to any other veterans that are on the line today for joining us. Okay, Nevada here, Select Health, Smiths, Kroger kiosk are going to be not operating week of Thanksgiving. So you've got that week to call all your clients, call all your leads, set up appointments, do whatever. That's a great week to really get yourselves organized. Remember, add your Kroger leads to the tracking database, which is on your portal. And this just shows you a couple of photos how to do that. And again, WellCare have got an AEP halftime event in Las Vegas. It's next week on November 13th. So that's Monday, I think, if I'm right. So Monday evening, WellCare have their own AEP halftime. They're doing it on a Monday, I presume, because of Monday Night Football. And they are doing at Born and Raised Bar. So again, no presentations, no nonsense, just you being there. Tell them how AEP is going, celebrate you. We want to show you they want to show us their appreciation, top producer recognition, raffle prizes, drinks and appetizers. They're going to provide some appetizers and drinks. Great opportunity to go there. I know they've done this a few times this week in California as well, WellCare. So they're doing a really nice job of celebrating all of you and us. If you want some leads or you want to talk leads, they have their event every Tuesday and Thursday. Obviously, next Wednesday, we've got the opportunity for all of you to participate in Nevada in the Call Blitz. Guys, if you want more clients, you should absolutely be jumping into this next week. I think it's between 11 a.m. and 1 p.m. on Wednesday. They're also doing some additional training, and this is for folks that if you're not busy, they're trying to offer opportunities where you can drive your enrollments. United Healthcare also doing a couple of trainings, or they're calling it learnings. It's coming up. One is next week on the 14th, and then the week after on the 21st. In California, there's some new applications coming for your med subs in California and Colorado if you sell there as well. Special enrollment period for qualifying Medicare beneficiaries, as we know, is ending on 12/27 or at the end of the year. So please make sure any folks that miss out on certain things, you'll be able to enroll right through the end of the year. Anthem's Medicare supplement bonus has been extended right through July next year. So that's good news for those folks that are selling Anthem MedSup. Blue Shield of California, the underwriting holiday as well. You've got the opportunity to earn more money through their bonus program as well. And then Blue Shield, Mary is doing a ton of trainings there in LA County, but also if you look here, there's some in-person coffee and chats throughout Southern California. Molina's talking about the 4 weeks left on AEP. They want to remind you that they're here to support you every step of the way. Rebecca is their broker channel manager in California. She wants to help you and support you in your Molina efforts as well. United Healthcare are doing a ton of trainings, as you can see, every single week, including MedSup, MA, MAPD, all of those types of products. Take a photo. You should have received an email where you live for your local area from United. And of course, WellCare we just spoke about. Look at all that training they're doing every single day throughout the last 2 weeks of AEP. And even more stuff going on next week as well. And more. Other stuff. Aetna have brought out a ton of stuff this week nationally around why choose Aetna. Obviously, they got the national brand. They have the backing of, don't forget, they're part of the CVS brand. CVS owns Aetna. That's a huge deal. It's a huge brand. That brand is bigger than United Healthcare. It's the biggest healthcare brand currently in the marketplace as well. They've got great compensation, technology, portfolio products, etc., and they're doing a ton of webinars next week. Cigna as well are doing brought out a cross-selling toolkit, increasing your client's financial security. So this is talking about some of those supplemental benefits that they offer as well, and there's a training next week on it. And Berwick has brought out some information on the plan enroll campaigns. There's a ton of plan enroll campaigns as well. So please be on the lookout for the discounted programs. So if you're a plan enroll agent and you want to get certain leads, look out for some of the discounts. Imperial Health Plan in California is offering a marketing reimbursement. So if you sell 20 apps through December 7th, you can actually get $100 per app. The expenses must be incurred, You can read all that information as well. You've got to write 20 apps to get $1,000 marketing expenses, and they'll reimburse you an additional $500 if they stay on the plan for 90 days. So you get $1,500 by the end of March. Pretty cool, right? And again, this is marketing reimbursement. So Vincent Stubbs is the sales director for Imperial Health. And again, of course, they've got HRAs they're paying, et cetera, et cetera. These are all the qualifying counties, as you can see. If you look through it, includes LA, includes Northern California, San Francisco, Santa Cruz, et cetera, et cetera. Lots of counties in California. Okay, and Integrity brought out some emails this week to talk about their high quality leads, as they're calling it, real-time leads, all of those types of things. There's a video that shows you how those real-time leads work, et cetera, et cetera. LA Cares talking about the special enrollment period as well. And again, their enrollment period ends on November 30th. And then United Healthcare is talking about some of the MAPD plans that have dental, vision, and hearing. And the fact, don't forget, they have the DVH plan as well. It's 0 physical exams, tests, and mammograms, and colonoscopies. And again, you've got the largest national provider network, Nurse Helpline, and their UCard, where you can get all of your benefits, or for your clients. And again, United is bringing up a standardized approach on their plan naming system as well. Do I need to re-enroll a plan with a new name? No, you don't. They're just going to go on that plan. But obviously, if they want to change plan, then you do have to change their plan as well. PhD is also available in Spanish. So if Spanish is your preferred language, you can call that number 1-866-235-5990. Great opportunity if you want to talk to the folks in Espanol. Lots of resources, etc. for AEP. Of course, you've got the plan compare opportunity, or the Medicare product portal as it's now known at United, where you can see all the plans across the United States, and you can find out who's the broker manager, who to reach out to, etc., etc. And then, as you saw there, you might have seen in the news, Community Plan of Arizona, which is Medicaid, is a proud sponsor of the Casa de Respiro development, and they've donated $500,000. That is it for today. Have a wonderful, wonderful, wonderful weekend. Please, there's 4 weeks left, folks. This is your time. This is the time to really get your activity on. If you're not working weekends, we've got opportunities with call blitzes. We've got a ton of stuff going on. This is the time for you to get out there. Do as much activity as you can between now and Thanksgiving. And then really after Thanksgiving, follow up on those leads. Give yourself time to write business. Don't overcommit yourself for those 2 weeks. We are expecting those 2 weeks to be extremely busy as well. That is it, I think. Have a wonderful weekend, and I'll speak to you all soon. Take care.